Did you know that nearly half of adults in the United States have high blood pressure? What's even more surprising is that many people don't even realize what's causing it. High blood pressure is the force your heart uses to pump blood through your arteries. And it also depends on how wide or narrow your blood vessels are. When your blood pressure is too high, your risk of serious health issues, like heart failure and stroke, increases. The more you understand what's raising your blood pressure and how it affects your body, the more likely you are to manage it. The good news is, in this video, we'll walk you through the 15 main causes of high blood pressure. And number 12 is something most people don't even realize. So make sure you stick with us until the very end of the video. Here's one of the most common causes: smoking. Smoking or chewing tobacco can cause a sudden spike in your blood pressure. For some, this effect is temporary, but for others, it poses a serious risk to their arteries. Tobacco products, such as cigarettes, cigars, and pipes, contain harmful chemicals like nicotine, carbon monoxide, and thiocyanate. These substances damage the walls of your arteries, restrict blood flow, and force your heart to work harder, increasing the risk of hypertension over time. Moving on, being overweight or obese is another major factor. Excess weight increases your body's demand for oxygen and nutrients, forcing your blood vessels to work harder to supply them to your tissues. A larger body size can also raise blood pressure because your heart has to pump harder to supply blood to all your cells. Carrying excess weight can interfere with how your body uses insulin, potentially leading to insulin resistance and type 2 diabetes, another risk factor for hypertension. The good news? Maintaining a healthy weight is one of the most effective ways to prevent high blood pressure. And for those with mild high blood pressure, losing weight can often resolve the issue without medication. Next on the list is consuming too much salt in your diet. Most people in the United States consume far more sodium than they should, mainly from table salt and processed foods. According to the Food and Drug Administration, the average daily sodium intake for adults is 3,400 milligrams, 48% higher than the recommended limit. The FDA suggests limiting sodium to 2,300 milligrams per day, while the World Health Organization recommends 2,000 milligrams. The American Heart Association advises even lower, at 1,500 milligrams, especially for those with hypertension. It's the sodium that causes all the problems by increasing water retention in your body, which puts stress on your heart and blood vessels, causing your blood pressure to rise. Studies have shown that moderately reducing sodium intake can help lower blood pressure, no matter if you already have hypertension. Moving on, lack of physical activity is another key factor. Getting too little physical exercise can affect your health in several ways. It may contribute to weight gain and worsen mental health issues like anxiety and depression. Exercise helps prevent excess weight gain and supports maintaining a healthy weight. It also has a positive effect on blood pressure, boosts energy levels, and enhances overall well-being. Regular exercise strengthens the heart, allowing it to work more efficiently, which can help lower blood pressure. Aim for at least 300 minutes, about 5 hours, of exercise each week, and try to minimize prolonged sitting throughout the day. Drinking too much alcohol can be a major contributor to high blood pressure. Here's why. Your body naturally produces a molecule called nitric oxide, which plays a crucial role in maintaining healthy blood vessels. Nitric oxide acts as a vasodilator, helping to relax the muscles in your blood vessels, improving blood flow, and ensuring that your organs get the oxygen they need. But when you consume alcohol in excess, studies show it can reduce your body's ability to produce nitric oxide. As a result, your blood vessels become narrower, making it harder for blood to flow smoothly. This forces your heart to pump harder, which ultimately raises your blood pressure. Health guidelines recommend limiting alcohol consumption to 2 drinks per day for men and 1 for women. Next, excessive stress. We often feel emotional discomfort when faced with a stressful situation. Our bodies respond by releasing stress hormones into the bloodstream, which causes our heart to beat faster and raises our blood pressure. When a stressful situation ends, the body naturally reduces the levels of stress hormones like cortisol and adrenaline, allowing the body to return to its normal state. But in modern life, many people experience chronic stress, meaning the stress never truly goes away. As a result, the body stays on high alert, and blood pressure doesn't get the chance to return to normal. Finding ways to manage stress can help your heart slow down and bring your blood pressure back to a healthier level. The next cause of high blood pressure is the natural aging process. According to the National Institute on Aging, the risk of high blood pressure increases with age due to changes in our vascular system or network of blood vessels. Younger people typically have blood vessels with greater elasticity, which helps blood flow smoothly. However, as we age, the walls of our blood vessels begin to lose some of that elasticity. Arteries and veins become less pliable and are narrower. As a result, your heart must pump harder to maintain proper circulation. This extra effort, combined with increased pressure on your blood vessels, can lead to high blood pressure. In addition to aging, genetics may also be a factor in high blood pressure. Research suggests that high blood pressure results from a combination of factors, including genetics, environment, and behavior. If any of your family members have been diagnosed with high blood pressure, you may be at a higher risk of developing hypertension later in life. However, it's not just about genetics. Familial hypertension can also be influenced by shared lifestyle habits, such as smoking or an unhealthy diet. The first step is to inform your doctor if any of your family members have been diagnosed with high blood pressure. Your doctor can then recommend preventive measures to help keep your blood pressure in check. Another cause of high blood pressure is the side effects of certain medications. Medications like steroids, non-steroidal anti-inflammatory drugs, decongestants, antipsychotics, and birth control pills can raise your blood pressure. It's not just prescription drugs. Certain natural supplements can also raise your blood pressure, like arnica, ephedra, ginseng, guarana, licorice, and St. John's wort. If you have high blood pressure, it's important to talk to your healthcare professional about all the medications you're taking, including any over-the-counter drugs. Moving on, chronic kidney disease may also cause high blood pressure. Healthy kidneys filter about half a cup of blood every minute, removing waste and excess water to produce urine. But in people with chronic kidney disease, the kidneys can't remove waste as quickly as the body needs. When the kidneys don't work properly, waste and extra fluid build up in the blood, leading to water retention. Water retention can cause your blood vessels to constrict, and this means your heart has to pump with more pressure. That's how kidney diseases can cause your blood pressure to rise. Next, adrenal and thyroid disorders may lead to high blood pressure. The adrenal glands are small glands located on top of the kidneys that produce hormones like cortisol, adrenaline, and aldosterone. Aldosterone, a hormone produced by the adrenal glands, primarily functions to balance the sodium and potassium in your body. When there is too much aldosterone, the body retains excess sodium, leading to water retention, which can cause your blood pressure to rise. Similarly, too much thyroid hormone can raise blood pressure by speeding up metabolism, which causes a faster heart rate and forces the heart to pump harder, raising blood pressure. Moving on to number 12. Poor sleep, something most people don't even realize, can have a big impact. According to the Centers for Disease Control and Prevention, most adults need at least 7 hours of sleep each night for optimal health. But many people don't get enough, and that can affect your health, especially if you have high blood pressure. When we don't sleep enough, or don't get good quality sleep, our bodies miss out on the rest needed to regulate stress hormones, which can lead to high blood pressure. Number 13. Excessive caffeine intake. Caffeine is found in many common drinks and foods, including coffee, tea, soda, and energy drinks. Research shows that nearly 90% of U.S. adults consume caffeine every day. The American Heart Association states that caffeine isn't harmful to your blood pressure unless you consume too much. However, it can cause a temporary spike in blood pressure, especially for those who don't regularly drink it. On the plus side, the AHA also mentions that drinking coffee may reduce the risk of chronic conditions like cancer and heart disease. If you have high blood pressure, it's wise to monitor your caffeine intake carefully. Number 14. Pregnancy. High blood pressure that develops during pregnancy is called gestational hypertension. If diagnosed, managing it properly is important to protect both you and your baby. Doctors typically define it as a blood pressure reading of 140 over 90 millimeters of mercury or higher. Several factors can increase the risk, including being overweight or obese, lack of physical activity, smoking, alcohol consumption, a first-time pregnancy, or a family history of pregnancy-related hypertension. Other risk factors include being 35 or older, undergoing fertility treatments like IVF, or having conditions like diabetes or autoimmune diseases. However, you can help prevent high blood pressure during pregnancy by managing lifestyle-related risk factors that are within your control. Number 15. Sleep apnea. Sleep apnea is a condition where your breathing repeatedly stops and starts during sleep. These interruptions cause oxygen levels to fluctuate throughout the night. When oxygen levels drop, your heart works harder to ensure that your cells still receive the nutrients they need. This added strain on your heart can lead to an increase in blood pressure. In summary, there are several factors that can contribute to high blood pressure, and sometimes more than one cause is involved. The good news is that many of these factors can be managed with lifestyle changes. Understanding the causes of your high blood pressure helps you take steps to reduce stress on your heart and blood vessels. If you enjoyed this video, be sure to subscribe to our channel, Blood Pressure Healthcare. We're a professional team dedicated to providing expert advice on all things related to blood pressure. Stay healthy, and we'll see you in the next video.